Hello and welcome to our latest Coffee with interview. Today I'm interviewing Jo Stanford, who is a senior dietitian and the child and family team leader in community health at Eastern Health. Welcome, Jo. It's great to have you here and thanks for joining us.
Thank you very much.
Before we begin, I'd like to acknowledge the traditional owners of the land from which we are meeting today, and I'd like to pay my respects to their elders, past, present, and emerging. I'm on the land of the Wathaurong people. Can you tell me where you're joining from today, Jo?
I'm from Wurundjeri.
Excellent, thank you. So, can you tell me a bit about your role at Eastern Health and the work that you do?
Yes, so I'm the child and family team leader, which incorporates overseeing a number of programs, the paediatric allied health services in the community health program, also the health promotion program, a number of adults and children counselling services, healthy mothers, healthy babies. So we do have quite a range of services here within our team to support families and children in the community. So I'm also,
Sorry.
I'm also a paediatric dietitian, so I have a clinical practice as well, and I support families and children with nutrition concerns. And at being the senior dietitian, I also support the other dietitians as well with their clinical needs too.
You sound very busy. You got a lot going on.
It is a busy job, but I love it. It's very varied, interesting, never boring, that's for sure.
Oh, that's great. And what excites and motivates you in your role?
Look, I think it is the variety and lots of different people that I get to work with. As a dietitian, I've had a lot of experience as far as working with the community in healthy eating projects and working with adults and children with their own nutrition concerns. But I think what I love about this job as well is the opportunity to learn about speech pathology and occupational therapy and nursing and social work and the types of work that they do as well, and how we all link together and work as a team to support the community. So, and I think that's been something that I've really valued over the last few years, is how we've connected more as a team around what we do to support families, and that's been really valuable for all of us, I think.
Oh, excellent. What have you seen as the main impacts of COVID-19 on healthy eating in our community, and how will this change the work that you do?
Yeah, there certainly has been some significant impacts, I think. Lots of people have gone either one way or the other when it comes to healthy eating during COVID. We've had some good research that shows that some people have been eating healthier while they've been at home. They've been cooking more, they've been trying out new recipes, they've had a bit of extra time to prepare foods. There's also been some studies that have shown that there's been more home growing of food. So there was quite a run on things like seeds and garden supplies early in the lockdown. I think it's a bit of survival mechanism, perhaps. Let's start growing our own. I mean, I think it's fantastic because I've been growing my own food for many years, and it's one of my big passions is to have a backyard veggie garden and grow and cook my own produce. So I'm very happy when other people have an excuse to go that way. The other side is that, lots of people have been home more and potentially more stressed. And I think there's been more, comfort eating and snacking. And also, we know that there's been a little bit more alcohol that's been drunk over this time as well. So, there's gone both ways, and same with exercise. Some people have done more exercise, and certainly I think a lot of us will recognise that lots of people walking in the streets during the lockdown periods, but other people have done less. So I guess we can't really generalise, but I guess one thing we can say is things changed, and things changed quickly, and perhaps some of those positive things that we learnt out of that time we can continue on with.
That's a really interesting insight. Yeah, I think it's interesting hearing say it's gone both ways, because I guess I've probably heard people say, oh, it's gone one way. So yeah, interesting that you've got the two perspectives going on. Thank you. How can PCP partners get involved in your work or Eastern Health's work in this?
So one of the things that I support is the health promotion team at Eastern Health. The health promotion team work in a range of ways, and some of our priorities include working around healthy eating in the community. We also support physical activity and looking at reducing harm from alcohol and drugs, and looking at prevention of violence against women. So there's quite a varied work that we do there. And although I'm a dietitian, it's been really great learning about these other aspects of different ways of staying healthy. So when it comes to the healthy eating work that we've been doing, a lot of what we've done so far has been settings based. So we've worked with using the Healthy Choices program in schools, in the canteens at Eastern Health, and also in sporting clubs, mostly footy so far, but we've got plans to be working with a wider range of sporting clubs. So that's work that's been going on for a few years, and we've been really effective in some of the settings that we've been working with at altering the culture around healthy eating. I think though there's a long way to go. We don't make our food choices in a vacuum. Whenever we go to buy food, we do that based on what food's available to us, on how much it costs. We do that on our culture, on how our knowledge and understanding of food and cooking and nutrition. So we buy foods based on a whole range of aspects of the food system, and so where we're putting our efforts into towards the future is actually looking at making the food system healthier. I'm very much of the belief that even though I'm a dietitian and I work with people individually, they're only making those choices within a bigger framework, and if we can positively influence that bigger framework, then that's where we can really get some bang for our buck and some more sustainable change. So what's happening now is that a lot of partners in the East are talking more, and I think certainly the Inner East PCP and Outer East and the councils and the other community health services, we're all starting to chat a lot more, and we're putting together some frameworks for shared planning and for collective impact. So I guess that's sort of the future for us as far as health promotion around healthy eating goes. It's going to be continuing to do the work on the ground with the community, but also working with the organisations and sectors that have influence on food and on physical activity, because it's often similar, and how we can make the healthy choice the easy choice for people at home. So I think that's something that any organisations who are in the East who are wanting to step up and get more involved, because health is not just for hospitals, and I think the health promotion sector is a challenging place to work, because a lot of the recognition and funding for health goes into the hospitals and into the treatment sector, and when you're trying to prevent illness or keep people well or keep people healthy, it's hard to measure that work. It's hard to pinpoint that that's your success, because we haven't got numbers of how many people we necessarily kept healthy. So we really need to look at prevention as being just as a valuable part of the health of our community as the treatment. And so all of the organisations who can influence the food sector in some way can potentially play a role, because it is everyone's business how we're keeping the community healthy.
That's great, thank you. You've given some really good examples there. I loved hearing about the food systems and how you're working with other organisations and urging others to get involved as well. So with Christmas and holidays now behind us, what advice do you have for keeping ourselves healthy in 2021?
I guess keeping those positive changes that you might have made last year or during the COVID lockdowns, where people did start to do a few things a little differently. Let's keep those going. As I was saying, I tend to think that people make choices based on the wider environment, but we do still make choices, and we can still alter those choices. It's important though that you make choices around your food and your exercise based on what your body needs, and not, you know, necessarily how many calories are in it, or how many kilojoules you can, you know, count for the day, or how many kilograms you lose. You know, that's not necessarily the end game. You know, the end game is how well it makes you feel. And eating intuitively is something we can learn. It's something that you can be taught. You know, that's something that dietitians are actually, you know, very good at working with people around, is supporting intuitive eating and making good decisions around food. So, you know, perhaps that's something that people can, you know, look up or ask questions around, is how to make good choices around what's best for your body and your mind, and not necessarily what the internet says to do, or you know, what you think is right.
Yeah, listening to your own body and knowing your own body.
Yeah,
sounds really important. What strategies have you found that have helped you when you have been working from home?
I've been lucky to have had the best of both worlds. I've been working a couple of days a week in the office and a couple of days a week at home, and I do feel like I've been very lucky with that, and I'm grateful that I've been able to connect with my colleagues, you know, face to face during that time, but as well as have a few days where I don't have to get in the car and drive to work. So, but the other side of that is that I'm also supporting, you know, a fairly large team who are mostly working from home. So, you know, it's actually been up to us and our senior staff members to support others around what they might be, the challenges they might be feeling while they're working from home. So definitely connecting with somebody else every day and making sure that you at least have a phone call, you know, or emails, or a video with somebody every day, just so that you you know, you have that interaction with other people and you're not just staring at a screen. That's really important. I certainly find that taking a lunch break, I don't always practice what I preach, but taking a lunch break is important when you're at home. And so, you know, getting outside and getting some fresh air, and, you know, perhaps actually cooking up a little healthy meal for lunch, which you might not have done if you're in the office. But, that's something that I've actually really enjoyed doing, is just spending a few minutes, you know, whipping up something at lunchtime. Yeah, so like, I guess I haven't had to hole up at home for months, so I haven't had that experience that many have. And my working from home, except for the odd IT glitch, which, you know, is just about being patient. Except for the odd IT glitch, I'd say my experience working from home has been vastly positive.
Oh, that's great. That sounds really good. And I really like that you said about cooking, like making yourself a lunch that you might not get to have when you're in the office. Like maybe it's just a sandwich that you've had there since the morning. So yeah, a fresh meal is a real perk, I think.
Yes, one of the things I've been cooking lately has been using Asian soup pastes, like a tom yum or a Vietnamese pho paste, and then you just throw in some vegetables, and maybe if you've got a little bit of meat or tofu or something there, to throw that in. And that's something you need to cook and eat fresh, but it literally takes like less than 10 minutes, and that's been one of my go-tos.
Might have to give that a go. Thank you. That's a really good tip. I have to try that one. And that's a nice little segue into the next question. During lockdown, did you have a favourite recipe that you had baked or cooked?
I'm terrible with recipes. I do love cooking. Cooking is my downtime. You know, if I'm looking for something to do to get my mind off things, I'll cook. So I did buy myself a pressure cooker. So I've been playing around with that, and, you know, throwing in a range of different veg and meat, or some legumes or something, and making soups and casseroles and curries. And whatever's left over, I put into a container that in the freezer for when I do go into work. So I've got some nice lunches then. So that's one thing, the pressure cooker. The other thing is, one of my favourite things to do is to grab my harvest basket and go out into the garden at 5 o'clock at night and see what's there and what's ready to, you know, it might be a couple of beans and a bit of lettuce and some spring onions or something, you know, whatever's there. and I'll bring that in and then just think, okay, well, what can I cook with this? So it's very much that sort of on the fly, you know, throwing together a meal from what I've got in the garden, a little bit of my own mystery box, I suppose. So me and recipes don't work at all, but give me a range of odd ingredients and I'll see if I can work out a meal for you.
Oh, lovely. That's a good skill to have. Very thrifty and resourceful.
Yeah, it's something I quite enjoy doing. So my kids don't necessarily enjoy it. So they're likely to be served a range of weird stuff, but they're used to me now.
Do they get in on the cooking as well?
A little bit more as they're getting older, yes. I'm trying to encourage a bit of that. But yeah, not as much as I would have liked, I have to say. But, you know, they'll hate me for saying that.
And what are you looking forward to in 2021?
Look, I really think there's a lot of positive energy in the air, particularly in where I, you know, am aware of in public health and in health promotion and in the healthy eating and other sectors around in health promotion. I think that, you know, the way things changed last year gave us a real insight into what we can do if we need to. You know, we had a health crisis and we had to change straight away, but there's been this underlying health crisis around chronic disease for many years. And, you know, it would be great if we saw some real inroads into different sectors and different parts of the community taking some action on that. So I feel like where the opportunities are is going to open and expand and change. And I think that's what I'm looking forward to is seeing and seeking and opening new opportunities around, you know, how do we help people stay healthy, both mentally and physically.
Oh, thanks, Jo. I thought that's a really nice positive note to finish on. Thank you. Well, thanks so much for your time. It was great to speak with you.
That's okay, no problem at all.
And all the best for 2021.